Thank you very much. Good morning, my distinguished members of the Rotary Club of All Nations. I am very pleased I was given this opportunity once more to share with you all about what's happening in my neck of the woods, Jamaica. Permit me to share my screen as I have a pretty short presentation basically highlighting what has been going on. So, slideshow. Brilliant. So, first and foremost, I really have to express gratitude to you all for allowing us to receive the donations of food items and medical supplies. They have made a impact on the persons vulnerable, especially the elderly persons who I really have a deep passion and care for. In communities still recovering from economic hardships and social challenges, your kindness has reminded many people that they are not forgotten. The support you provided was more than material assistance. It was hope, dignity, and reassurance during difficult times. And I'm more specifically talking about the period subsequent to Hurricane Melissa. Intermittently, I will share a few pictures of what has been going on in terms of snapshots of persons hand delivering supplies. Now we know the Rotary has a spirit of service. Motto states service above self, and it's clearly reflected in every act of generosity shown to Jamaica. The Rotary's mission of compassion and humanitarian outreach continues to inspire communities, especially in the St. Catherine area where I am based. Your support demonstrates that it's not just about giving items, it's about restoring dignity, as I mentioned before, encouraging resilience and strengthening communities. So many elderly persons who live alone, who do not have access to basic resources, largely due to limited income, expressed that receiving the help that they did reminded them that there are still people out there who care for their well-being. This is another example, them receiving some supplies. Now, the support received include donations of food packages, more specifically like canned goods. And this is important because these non-perishable food items allow them to have proper meals, even though they don't have probably a gas cylinder or electricity for electrical stove support, most of which would have been washed away during the hurricane. And so rice, flour, hygiene products, medical supplies, adult care items that were delivered, and other necessities were indeed valuable. For many seniors, simple items such as soap, toothpaste are difficult to afford and also access based on their location and the damage that we sustained. So the donations definitely ease the financial burdens and provide relief to families struggling to care for their aging relatives. And the situation is that many persons who are in one end of the island who has relatives in another end of the island were damaged badly were unable to deliver items because of unable to navigate the terrain, the bad roads, etc. Currently, I should mention that things have improved, definitely improved. I'm not sure how many of you fellow members would have access to the local news here in Jamaica, but strides have been made in terms of clearing blockages, in terms of restoring electricity supply. Many would have thought that, okay, the rest of the island is bearing the brunt of the cost. However, most, if not all, places have returned in terms of electricity, but there still remains a need, right? So definitely communities have benefited from improved nutrition for sure, better healthcare access, because again, Based on the news I have received, facilities have been rebuilt, not necessarily restocked, but the structure is coming together over the past couple weeks to months. Um, but elderly individuals who were once isolated and struggling have now received some amount of assistance that improve their daily quality of life, and that's a plus. Personally, and I've received news that persons would have benefited from the medical supplies also received. So, more specifically, the hard colors, we received approximately 60, between 50 and 60 hard colors. For those of you who do not know what I'm talking about, it's basically a neck brace around the neck. And this is important for patient care and delivery. So, especially where I'm located in an area called Linstead, we are located just across the highway that connects the eastern end of the island from the western end of the island. And this is important as most of the tourist areas are on the western end of the island. And so persons travel very quickly across the highway and oftentimes intoxicated and meet in accidents. And the nearest hospital along the highway is my hospital. So they come in with trauma and they would need stabilization of their cervical color, cervical spine, and therefore we would definitely have utilized these cervical colors, definitely delivered from Rotary Club of All Nations, and they have been useful. I remember one sister, we call the nurses, the head nurses, sisters. And so sister would say to me, Taylor, we are ensure you express thanks to the Rotary Club for these art colors because we didn't have them before. We were using soft colors, for want of a better word, basically cottons on our hands and basically hold them in place to travel them to a more tertiary institution for more supply, for better care. And so we were able to have more persons being receive better patient care, and that's definitely a plus. So we're thankful. Continuing, many elderly citizens express gratitude, as I said before, it eased their daily struggles and quality of life. More importantly, I remember one young lady, one elderly lady, sorry, saying that she would have skipped meals because, she mentally planned to say, hey, I'm going to let this kind of food serve me for weeks. And when she saw our welfare outreach truck coming, and she was able to receive meals for the rest of the week going forward, she was tearful, in terms of saying she has she used to have a dim look on society, dim look on, persons not caring for one another, and this totally changed her view. And definitely the kindness shown impacted her a lot. So while stories like hers show the positive impact of your generosity, our generosity as a club, there are still many elderly individuals who are still facing similar struggles. So as I mentioned before, the medical supplies definitely saved lives, and we're thankful. So I'm talking about gloves, the syringes, the tubes that were sent, the giving sets to deliver either blood or fluids in terms of aid in resuscitation, definitely a plus. So I remember also that one gentleman, he was in the rural area of Banbury, I believe. Can't remember his name. So he said he has a chronic illness. And so when he received the medical assistance, he said that his comfort level, because he has what we call a bed sore. The fancy name is decubitus also. And so when you receive the wound care equipment, so the gauze and the tape, etc., this definitely improved his comfort level as he wouldn't have to stay he would get more daily dressing, so to speak, and he doesn't have to travel the bad terrain to go to the clinic. He can just have his relatives change him right there on the spot every single day. And that definitely improved his comfort level and reduce his stress level as well. And that's very, very important and a plus as well. So families, as I mentioned before, who are far away from their affected relatives on the other end of the island, definitely shared that they would have received benefit. Additionally, well, what would have taken place is that I would have combined the help. So it wouldn't be just from Rotary Club. I attend a church, and therefore the welfare committee and I, reached out, and we did had a welfare outreach on a particular day. So, it was a lot of stuff was delivered. So when they received it, they were definitely happy. It reduced their hunger, improved nutrition among them. One community volunteer shared the story of an elderly couple, again, who has been rationing their meals due to financial hardship. And after receiving assistance, they were able to eat regular meals. And that sounds very simple, but very important. And they expressed overwhelming gratitude. And just to interject, these persons, they just do not have it. But in the same breath, being there from about 8 a.m. the morning to about 3:30, 4, by the middle of the day, these same persons who we have handed foods prepare the meal and try to feed us, try to give us back meals to say, hey, you guys have been here from morning, going through the community, handing out food. We want to offer you back something. And it was so overwhelming emotionally to see. And it's just to show the heart and the mindset of these persons. And it just encouraged me personally to give back to them more. So that's definitely a plus, and that's what has been going on. So despite the progress, although meaningful progress has been made, many elderly citizens remain in urgent need of support. There's still a strong demand for basic food items, hygiene products, and adult pampers. And that's important. Again, in the hospital, I've seen it from day to day. Persons are in the hospital for a protracted period of time, and therefore their hygiene products have run out. The hospital has run out as well. And so, that's an area that's lacking. Most seniors are bedridden, living in chronic illnesses, and rely heavily on caregivers, heavily on the administration of the hospitals. And so personal hygiene supplies sometimes are often too expensive for low-income households. Families frequently choose between either eating or caring for the physical needs of their relatives. So our continued support can help preserve dignity and improve quality of life for these vulnerable individuals. Um, so sheet sets, bedding supplies, household appliances to improve comfort at home. Again, because the structure is there sometimes, but they're not able to retrofit the homes or the structures prepared. Let me use this opportunity to interject. I don't know, again, how many of my fellow club members would have been paying attention to the local news. Probably this week, the story would have come out that probably about 1%, correct me if I'm wrong, 1.8% of the support in terms of financial support received worldwide to the Jamaican government have been utilized. In other words, millions and millions of dollars earmarked for restoration for community members in Jamaica have not been utilized, and persons are there suffering. One could say this is political. One could even hint at probably corruption. However, persons are still suffering. And, in the back of your mind, you say, okay, why we don't advocate for these things? And sometimes we feel it's out of our control. But I guess at the level of the club, we should not use this as to say, we'll not give anything more because it's not that there are funds not there to care for the Jamaican people. But we should still aim and purpose in our hearts to still give and to remember our motto, service above self. And despite what's going on, in terms of from a government level, we can still do what we can. It's still disheartening to hear. It's still something to highlight. And possibly, if it is that external pressure is placed and it's being brought to the forefront, it will force the government's hand to utilize the resources donated from persons to the full extent to alleviate the suffering of persons, especially in rural Jamaica. Another point I would like to quickly highlight is that social isolation is an issue. It's a growing concern among elderly Jamaicans. Many seniors are separated still from family members living overseas and have limited access to communication devices. Simple technology such as tablets, phones, probably internet connectivity devices are a big thing, and it will definitely ease their emotional well-being. And definitely moments like when I see an elderly person use my telephone or my friend's telephone to call a relative in the other end of the island, that did a lot. It did a lot in terms of saying, okay, I can see you, I know you're okay. That did a lot. So persons, don't have access to these things. Again, low income household. So that's another point. So coming to partnerships is always necessary as an international club. We have to partner with persons, and definitely the success of the initiative was made possible through that. Certainly the Rotary Club of All Nations, local healthcare workers like myself, volunteers, church members, community leaders all played a role. And looking ahead, this is what will help us to continue to be successful, right? Again, there are a lot of stories of hope. Persons said that, the move and the outreach initiative gave them hope during a difficult period in their lives. I can begin to tell you about stories, stories upon stories, but they're all saying the same theme. They're thankful, but there still remains a need. All right. This is Miss Eddie. This is her home that was damaged, and she was still offering to us items of food in her hardship. So our shared commitment is basically to continue to serve these vulnerable populations and expand our outreach to persons who need it. So we can transform more lives through compassion, service, and unity. And we wholeheartedly thank you, ladies and gentlemen, for your help. As we conclude, deepest gratitude to you all. Thank you very much, everyone.